Well, November is Lung Cancer Awareness Month. According to the American Cancer Society, more people die each year of lung cancer than colon, breast, and prostate cancers combined. Often people with lung cancers, they don't know they have the disease because symptoms don't appear until advanced stages. I spoke with a lung cancer specialist here in D.C. on why it's so hard to detect lung cancer. Our conversation is what's going around.
The issue with lung cancer is that too often people present to the doctor when they have symptoms, and by that point, it's very common for their lung cancer to be fairly advanced already. And so that makes it much more difficult, and we have way fewer options to treat cancer when it's more advanced in those more advanced stages.
Dr. Chan, what about vaping? So popular now. How is vaping factoring into lung cancer and lung cancer diagnosis?
The thing about vaping is that we really don't know a lot of data, especially long-term data, about the effects of vaping. So in general, we try to discourage people from smoking anything, inhaling anything into their lungs. Really anything that you inhale can damage your lungs and cause either long-term diseases or trouble breathing. We don't know if vaping causes lung cancer yet, but we certainly want to be very careful about that.
What are some of the new guidelines screenings for lung cancer that have been put out in the last couple of years?
It's a great question. So there have been lots of studies and lots of data that shows the benefit of doing lung cancer screening for high-risk patients. And we're defining high-risk patients as people who are between 50 and 80 years old, people who have smoked in the past or are currently smoking, and people who've smoked 20 or more pack years of cigarettes in their past. So we define a pack year as someone who smoked one pack of cigarettes per day for a year. So if you smoke two packs of cigarettes per day for 10 years, that's 20 pack years. Or if it's one pack of cigarettes per day for 20 years, that's 20 pack years also. So those three things, age, smoking history, and the amount that you've smoked, are the only criteria that we look at to see if someone's eligible for lung cancer screening or if they're high risk for lung cancer.
Dr. Chan, what are some of the symptoms of lung cancer in patients?
Unfortunately, a lot of times lung cancer has no symptoms at all. When lung cancer starts growing, it occurs in the lung tissue itself, and you really can't feel it. So you could have a lung cancer growing inside your chest and not realize it because you wouldn't have any symptoms. And that's one of the most important reasons to get tested, to get screened as early as possible. By the time it becomes symptomatic, some people will complain of pain in their chest. They might have a cough that doesn't go away. They may cough up some blood. Those are all more concerning signs, and usually signs that the cancer may be more advanced.